You are over 50, going about your day, when a sharp, alarming pain suddenly spikes in the lower left side of your abdomen. This often starts with small pouches forming in the colon wall as we age. Known as diverticulosis, they're common and usually cause no symptoms. But if these dormant pouches become actively infected, it becomes diverticulitis, turning a harmless feature into acute pain. Along with the localized pain, you may experience a fever of 38 degrees or higher, nausea, and unpredictable changes in your bowel habits, ranging from constipation to diarrhea. This leaves you facing an immediate dilemma: managing the physical pain while navigating contradictory dietary advice and the realities of healthcare waiting times. Before seeking a routine appointment, you must check for specific red flags. A fever above 38.5 degrees, extreme abdominal tenderness, persistent vomiting, or rectal bleeding are signals that your case is no longer uncomplicated. These symptoms suggest the infection may have led to a perforation or a rupture in the colon wall. This can trigger peritonitis or sepsis, serious complications that require immediate hospital intervention. However, if you are not experiencing these red flags, the majority of cases can be managed safely at home with rest and medical supervision. Identifying your personal symptom severity is the mandatory first step. Knowing where you sit on this spectrum determines whether you need an emergent change in diet. Confirming a diagnosis in the UK often comes down to a trade-off between your financial resources and your need for speed. The NHS GP route provides rapid access to a consultation and antibiotics for the standard £9.90 prescription fee. This is effective for treating the immediate infection, but a GP cannot see inside the colon to rule out other serious conditions. To get a definitive look, doctors rely on two imaging tests: a CT scan to map the inflammation, and a colonoscopy to examine the internal lining of the bowel. NHS scans are free, but a diagnostic colonoscopy involves a 4 to 12-week wait, delaying dietary changes. Privately, a CT scan costs £500 to £800, providing answers within days. A private colonoscopy ranges from £950 to £3,500. Paying out of pocket secures immediate answers. However, you have to weigh that cost against the fact that diverticulitis is largely managed through lifestyle adjustments, not permanent medical procedures. Managing your diet involves a specific paradox. The foods that help you heal right now are the same ones that could cause a relapse if you continue eating them long-term. For the first 48 to 72 hours of a flare-up, the focus is bowel rest, consuming only clear liquids and low-fiber foods. Removing fiber temporarily stops the colon from working hard to process bulk, allowing the acute inflammation to subside more quickly. But staying on this restricted diet for too long is counterproductive. It lacks essential nutrients and eventually leads to constipation, which increases the very pressure that causes flare-ups. Once the pain passes, gradually increase intake until you hit 25 to 30 grams of fiber daily from whole grains and vegetables. High fiber creates soft, bulky stool that moves easily, reducing internal pressure and preventing those small pouches from becoming irritated again. You can also ignore the common myth that nuts and seeds cause infections. There is no evidence they get stuck in the pouches. In fact, they are excellent sources of the fiber you need. Successfully moving from temporary bowel rest to a high-fiber lifestyle is your most effective defense against future hospital admissions. Surgery, such as a colectomy to remove part of the colon, is a major procedure that carries significant surgical risks. Because of this, current clinical guidelines reserve surgery for recurrent or complicated cases, meaning that for a single mild episode, your recovery depends on your daily habits. Your next move depends on your current priorities and the state of your recovery. If you are managing a mild case and want to avoid high costs, follow the NHS pathway. Use the standard antibiotic course and accept the wait for a scan, using those weeks to slowly transition your gut toward a high-fiber diet. If you need immediate certainty to move forward with your life, a private CT scan offers the best balance of speed and cost. For £500 to £800, you get a definitive answer in days, avoiding the much higher cost of a private colonoscopy. For those already past the flare-up, the focus is on prevention. Aim for 30 grams of fiber daily. Drink 8 glasses of water to maintain hydration, and avoid regular use of anti-inflammatories like ibuprofen, which are linked to a higher risk of complications. Finally, adding 30 minutes of moderate exercise most days, like walking or swimming, helps maintain healthy digestive motility and further reduces the chance of a recurrence. While these steps provide a roadmap for managing the condition, you should always consult with your GP before making significant medical or lifestyle changes to ensure they are right for your specific situation.